good?
I think so.
Dr. Hayes, for the record, say your name and spell it for me.
John K. Hayes, John-K-H-A-Y-E-S.
And your title here?
President and Medical Director.
At Gamma West.
Gamma West Cancer Services.
I guess let's first talk about Nicole's diagnosis, situation, just overall, how she looks.
Okay. I met Nicole when she was 39 years old, and this was 16 years after her first tumor in her tongue. The tumor was originally in the right side of her tongue. 16 years is right. Yeah. 16 years later, she developed another tumor right behind where her original tumor was. And that was excised in a biopsy fashion so that we knew it was another tumor of the same type. And she had to make some decisions about how to get it managed. And one of those decisions was whether or not to have it surgically removed. She saw a specialist in that who explained that the safest way to do that would be, from a surgical perspective, would be to remove half of the tongue and replace that defect with a piece of her own flesh from her arm. Skin and muscle would go in there. It's a major operation, and it can cure her. She was referred to me also, and we discussed other options.
So what's the downside of doing that process?
I would say the downside would be it's a major operation, and you never look quite right, you never speak quite right, you never swallow quite right. But they, you know, we've got excellent surgeons, and they save lives. The alternative was for me to put some little catheters into that area and to use a treatment known as brachytherapy, or high dose rate brachytherapy, and combine that with what's called interstitial hyperthermia. And so she decided to try and save her tongue without any further surgery. And in an operation, we put in a dozen or so catheters. Should I be exactly precise? How many?
11.
We put in 11 catheters. And through those catheters, we sent a little source of radiation. A very agile, powerful radioactive seed that delivered a dose of radiation right inside those tissues. Because that cancer was in scar tissue, I felt it important to use hyperthermia. And through the exact same catheters, we put some thermistors and some radio frequency antennas, and we raised the temperature of that tissue from 37 degrees Celsius to 43 degrees Celsius for 1 hour. We gave her the brachytherapy every day, twice a day, for 9 treatment days. And we did the hyperthermia about every 3rd day. I should be exactly precise. And she got about 6 doses. 5. Yeah, we did the hyperthermia 5 times during the course of that treatment.
So let's jump ahead and just talk about hyperthermia in general. It sounds like, and with all these different, I guess, do you call them modalities or different areas, you're able to get that specific, different locations, because we're going to be talking to different patients, right?
Right.
So talk about how effective hyperthermia is and the different places you're able to get the cancer?
So hyperthermia is a very, very old cancer treatment. It was one of the earliest cancer treatments discovered, but it hasn't been used that much. There was a lot of interest in it about 30 years ago, and a lot of research was done into hyperthermia. It's always been used since then, but it's had a hard time catching on in the greater cancer community, which is a little bit surprising because the best machine in the world to do hyperthermia is made right here in Salt Lake City, and it's sold throughout the earth. It's sold throughout the world. And it is used throughout the world in the treatment of cancer. There have been many studies now that show a benefit to the use of hyperthermia as a helper along with both chemotherapy and radiation. And so it is a way that we can make both chemotherapy and radiation more potent, especially if a cancer has come back after its initial treatment.
So let's talk about the challenges, because before the studies weren't thorough, or the approaches were different.
What has been shown is that if you get adequate heating to the tumor, you get a substantial increase in the rate at which that tumor completely goes away. I think one of the biggest challenges with hyperthermia is doing it well and actually getting the tissue heated. And many institutions just gave up because it was hard to do. This company in Salt Lake City didn't give up. It's called Pyrexar, and they continued to make the equipment and to improve upon the equipment. And now, the machine that we have, we can put catheters in tumors, we can put thermometers in tumors, and we can measure the temperature throughout the tumor and several points in the tumor and show that we are heating it, and heating it well and adequately for a period of time.
Overall, in recent years, and you've followed this and you've never lost faith in this method, what miracles have you seen? If you could give me a broad, like your thoughts about that.
Well, I have seen patients that really had no hope, and when we applied this treatment in conjunction with brachytherapy, tumors completely disappear, and patients get their life back. We use hyperthermia not in every patient. We use it in well-selected patients, and those we use it in are usually patients who are in big need, have significant problems.
By the time you receive the patient.
That's right. They have significant problems.
They've exhausted a lot of their...
And the chance of them being cured isn't that high. And so when we have applied this, and when we get a complete disappearance of the tumor and the patient stays well and has normal function, we feel like that's a miracle.
Let's see. Last time we did talk about why your thoughts of other companies not using it, or more places not using it. Did we touch on that?
So, just not too many years ago, when we talked about modalities in cancer care, they talked about radiation, chemotherapy, surgery, and immunotherapy wasn't even mentioned. Nowadays, immuno-oncology is an important new area of oncology, and we're seeing some pretty amazing new medications developed and used in cancer. hyperthermia is another reason, no, that is one of the other reasons why there's a resurgence of interest in hyperthermia. Hyperthermia allows blood vessels within cancerous tissues to dilate. It allows immune cells to penetrate into the tumor. It allows tumor antigens to be exposed to the body's own immune system. And we are seeing a synergy between immunology, the body's own immune system, and the use of hyperthermia. And so we're now seeing a greater interest in hyperthermia with this development of immuno-oncology.
Where do you see the future? And your hope?
My hope is that hyperthermia becomes a mainstream treatment in cancer care, that institutions will spend money to train people, to obtain the equipment and use it where it is indicated. And that the work of the thousands of scientists that have worked in hyperthermia, in the laboratory setting, in the animal models, and in the clinic, and in the papers that have shown a benefit, will not be forgotten, that it will be improved upon, and we'll see greater miracles happening in cancer care.
Anything else you'd like to say?
What should I say, Dave?